I'm Dr. Dan Michaels with the Reconstructive Foot and Ankle Institute, and today we want to talk about venous insufficiency, or edema. We have a lot of patients that come in with swelling of the legs, and this can be due to problems with the veins. Now, we've talked about arteries recently, but veins are a little different. Veins actually take blood from the foot and they bring it back to the heart. Now, it's kind of going against gravity because you're going from the bottom up. And so to help veins out, what's happened is we have little valves inside veins. They're one-way valves, so when blood gets squeezed up, the valves open up. And then when gravity kicks in and the blood wants to come back down, the valves close and lock, kind of like the C&O canal, all the canal openings. That's kind of how these veins, the valves in the veins work. So normally, when your muscles in your legs fire, that squeezes blood up and the valves open. When the muscles relax, the blood just wants to go back down because gravity is pulling the blood down. So the valves, since they're one way, they go down and they stop. And they don't let the blood go back because the whole goal of a vein is to get that blood back to the heart. And so what happens when you have leg swelling is sometimes your veins don't work. The valves become two-way valves instead of just one-way valves. And so the blood, when your muscles stop contracting and relax, the blood begins to go back down through the valve. And that causes a lot of leg swelling. And you can see some people, on some people's legs in the front shin area, there's brown spots. And those are kind of age spots. But what actually makes up the age spot is iron. When the blood goes back down and the leg swells, all the fluid in the blood gets squeezed out of the blood vessel. And with that fluid, there's a little bit of iron. And so over time, that iron gets into the skin and it stays there. It essentially tattoos the skin with brown spots. And those are basically a sign that your valves are not working well. Now, if you do have these problems, there's simple solutions to a lot of these. There is a test that we can do in the office that will determine how good or bad your veins are. It's a simple test. It takes about 20 minutes and it doesn't hurt. It's non-invasive and it determines how good or bad your veins are. And if you have varicose veins or a lot of leg swelling or this brown spots on your calf, you may want to consider having this done. Oftentimes to treat this condition, there's a lot of things that we can do to the veins, but simply wearing compression stockings, there are tight stockings that go from the foot all the way up to the knee, can help the veins out. They can help squeeze the fluid out. So if your veins are bad and the blood comes back down, your leg starts swelling, the socks can squeeze a lot of that out and take away a lot of the issues that you have. So venous insufficiency or edema can be easily treated and easily diagnosed. You just have to come by and let us do a test on you if that is what's necessary.